And now it's our pleasure to introduce Dr. Karen Feinstein.
Thank you, Bruce. And some things raise costs and then lower them. So that's going to be even more complicated. Anyway, I'm absolutely delighted to be here. I joined the Chancellor in giving Bruce and everyone else credit. I would say that not that many years ago, we would have meetings about clinical care, medical care. We'd have other meetings that were behavioral health meetings. And then, of course, we had meetings that were IT innovation meetings. And so I love it that we're all coming together. 25 years ago, the Jewish Healthcare Foundation was formed from the sale of Montefiore Hospital. And I said something really dumb as the first CEO. And I said, we can't do everything, so we're going to do health, but not mental health. Really dumb because you can't do one without the other. We became very aware of this 12 years ago. We had a talented research director. We were getting the PHC4 data, Pennsylvania Healthcare Cost Containment Council data, raw. And she was just kind of going through looking for an interesting problem to address. We're a foundation, we love problems. And she said, you won't believe this. She said, but 20 to 30% of patients who are discharged from the hospital return within 30 days. And we said, well, who are these people that are going in and out of hospitals? And it wouldn't surprise you, end of life. Many of them don't want to go in and out of hospitals, but that's another conference. AIDS, often a lifestyle issue, people living with HIV/AIDS, people with multiple chronic diseases. But what knocked us over is the number of people who were going in and out of hospitals within 30 days who also had been diagnosed with depression or substance use disorder. So we started to do a number of projects. It's been very lucrative for us and a growing experience for Robert Ferguson here. One was a small local project on integrating behavioral health into primary care settings, basically screening for substance use and depression. Then a bigger grant from ARC, that was a multi-state grant that took that concept on a broader level. And then an even bigger grant from the Center for Medicare and Medicaid Innovation called COMPASS, which has been not only multi-states, but we are the little tiny player with a lot of big players, and it's been very interesting. So we're now totally wiped out any idea that you can talk about health and not talk about mental health. They're two separate things. So we're very excited also. The next step for us was starting to think a little bit about how you could deal with mental health problems using technology, the theme of what we're here to do today. And I'll just tell you quickly an interesting experience we had. We used to have a fellowship called QIT, where quality improvement meets information technology. But we also had a separate fellowship called the Salk Fellowship. And in the Salk Fellowship recently, we broke the students into 4 teams. These are graduate students in a range of health professions. And we gave each team a problem. One was perinatal depression, one was adolescent mental health issues, one was campus rape, and one was seniors helping them live independently. And we gave them 4 lenses that they could look at these problems in, and then they were going to compete. There was a competition with a cash award. So the 4 problems you have, the 4 lenses: crisis management, predictive modeling, social activism, and last, disruptive innovations and technology. And every one of the teams chose what? Disruptive innovation through technology. So we said we may not need a QIT fellowship. They've already turned the existing fellowship into a QIT fellowship. So continuing to explore some of these dimensions, we had a wonderful session. A number of you were there. We organized Health 2.0, and it was IT solutions for behavioral health. Bruce was one of the presenters, and Brian, who I think is here. It was just a fascinating mix of who was in the audience, which is, I guess, a sign of the times. Physicians, psychiatrists, foundations, quite a few therapists, just an incredible mix. People who were studying, people who practiced for years, people who were head of their department of psychiatry. So I think this topic is enormously interesting, and we're just beginning to explore it. I would say that it's really a pleasure today. We have plenty of students who want to invent the next new thing. That is no longer our problem. And although we started limiting our QIT fellowship to graduate students, it was crazy because we have so many undergraduate students who are ready to invent the next new thing. We actually took our group of students who worked on adolescent mental health and we offered them each $1,000. They had come up with a little beginning of a prototype. And we said, we'll pay you to keep developing this. This is kind of an INR service for teens, just for teens. And something very interesting happened. We offered them some money, but we said, you know, we're not really business people. We're a foundation. So this isn't a project to get rich. It's for the good of teens. And they said, thank you very much. Keep your money. We're going to keep developing it. We prefer to get rich. So they need help, and we have it in the room for you today. By the way, since they've left us, if anyone here has some technology to help us bring information and referral services to adolescents who may feel that they're in trouble, please talk to us. But as I told you, often with us, you don't get rich. So we have two wonderful people here today to talk to you a little bit about how we take all these students and all their interests, and there's plenty of it, and help them actually develop a marketable product. One is Bobby Zappala, who's the CEO and co-founder of the Thrill Mill. People know that quite well. It's one of our premier early-stage incubator accelerators for entrepreneurs. Want to turn a great idea into the next best thing. I really think that Bobby and Thrill Mill have helped put Pittsburgh on the map as a global destination for a young generation of entrepreneurs. We're absolutely delighted to have Bobby here. He was at one point a corporate attorney at Buchanan Ingersoll, and you'll hear from him. And he will be followed by, Rich Lunak is not here, but our good friend Larry Miller is here. Larry Miller is executive in residence at Innovation Works. He helps entrepreneurs address product and business development, strategic planning. I know Larry as a wonderful mentor, if any of you are looking for mentorship. He led medical device companies for 20 years. He's president and CEO of Biomech, a technology accelerator, and has an undergraduate degree in mechanical engineering from Penn and an MBA from Wharton. So you have two wonderful people, and if any of you want to turn your product into a really wealth-producing thing, you're going to hear from the right people. So Bobby, I know you're here. I saw. Aha, Bobby, there you go.
Sorry, I was hiding in the corner. Well, thank you all for having me here today. It's great to see the way that the community has come together from across the university and from UPMC as well. It's a big reason why I do what I do. I, of course, first and foremost, started Thrill Mill because I didn't want to be a corporate lawyer anymore. But after that, it actually turned out to be a pretty good idea. But you know, all kidding aside, the purpose of Thrill Mill has always been to harness what we felt was a massive demand for startup support in this city that's being met in many ways that you're hearing about today, but that demand still exceeds the supply that's there, and that just goes to show you and is a testament to the amount of activity that's taking place in and around the Pittsburgh region. And what was really important to me, being from Pittsburgh, I left in the late 90s to go to college outside of Pittsburgh, which at the time, if you were part of kind of my age group, that meant like if you had an opportunity to go somewhere else, you were gone. You were not coming back to Pittsburgh. That was really kind of the traditional thought process. I followed that path for a little while and ended up in Washington, D.C., liked it there, but I had friends who went to CMU and went to Pitt and other universities around here, or maybe ended up back in Pittsburgh for a job shortly after college. And I would talk to them, and I'd come back and visit, and I would see this dramatic change taking place and all of this development and all these new companies coming in and really great opportunities. And I thought, this is not what people told me Pittsburgh was like, and I grew up there. So I wonder what the perception is to people who haven't seen the city as close as I have, or those who have arrived to take advantage of the fantastic academic institutions, or even maybe an early stage job opportunity, who are really looking at it at that point in time as saying like, all right, I'm going to collect what I can here, and I'm going to go to Boston, or I'm going to go to New York or San Francisco, or whatever the case may be. that was clearly starting to change. People were coming to the city, and people who were born and raised in the city were looking back to it and saying, I think there's a lot of opportunity here. I want to be a part of that, but where can I go? And, Larry will talk after me. He really, frankly, should have preceded me in this conversation because of all the fantastic work that Innovation Works has done to kind of set the table for organizations like Thrill Mill to exist. But, there were certain paths that an entrepreneur could go down. But frankly, there was still a lot of kind of gaps out there. And if we could keep filling those gaps, then we would retain more talent. Rasu mentioned, the concept of brain drain and trying to prevent that. We really wanted Thrill Mill to be a place where, regardless of what industry you were in, regardless of the type of company you wanted to build, if you were really a hungry SOB and you thought you had a good idea, we wanted to try to help you. And through my own background, the background of my co-founders, we had a great team who could really help build those fundamentals. And over the course of the organization's existence since 2012, we've worked hard on kind of refining our approach, making sure that when an entrepreneur comes to us, we really beat into their heads those fundamentals. And it's interesting, you see, even in companies who come speak to us really more from a business advice perspective, maybe they're scaling and growing, they still need to step back and refocus on those basic priorities that all business people, all entrepreneurs need to work on. What is your true financial strategy? What does your market really look like? Why are you getting up every day to do this? And you need to understand what steps you need to take to meet those next goals. And that's why we feel like we're able to actually assist businesses regardless of whether or not they're a VC-backed potential company or if they're a family-type business in development or even nonprofits that we help move toward a path of sustainability. So, our goal is to corral as much as we can in support. I think one of the things that's maybe important to talk about from a definitions perspective is, incubator and accelerator, and what does that really mean? You're going to hear different definitions wherever you go. For us, we tend to kind of treat both, and so we've defined them for ourselves. Incubation to us is really kind of a longer process, maybe a more informal relationship. It can be an advisory capacity. You might not be providing actual space, but you're saying, like, let's get together as frequently as possible. As much as you want our advice and guidance, we'll help, and we'll help you kind of benchmark out your plans. And then the other side of the coin, acceleration, is it like, okay, boom, we're going to invest in you. It's going to look like this. It's going to be, we're going to benchmark you very specifically over this path of time. It's time for you to grow and take it to the next level. So at Thrill Mill, we do both of those things. And in so doing, we're able to, we think, help a broader kind of cross-section of startups. Some don't actually need acceleration. Some companies don't need investment at the particular time when maybe they're coming to you saying, I've got a great idea and you need to give me all this money. It's like, no, that's not really where you are. You need to be working on more the fundamentals of the product and, this whole concept of innovation, which John did a great job of talking about. I mean, that's a very fundamental issue. Are you building a solution looking for a problem, or is there actually a problem out there that you're trying to solve? So really looking at those fundamentals and then trying to help guide entrepreneurs into the right places. I think in a broader sense, what we've really tried to build with Thrill Mill is kind of this community hub of startup activity where we can do our part with certain companies to fill in gaps and help an entrepreneur that comes to us that may be too early for an Alpha Lab or Alpha Lab gear or innovation investment that you'll hear about, Innovation Works investment that Larry will talk about. Or perhaps we can help support a business or in their early stages in their healthcare technology, and we have a partnership with UPMC Enterprises whereby we can take those entrepreneurs and say, that's not our area of expertise. It's time to turn them over to the real experts in that field. Now we'll see if you can continue to grow from there. So we don't want to do it all. We certainly don't want to do it all. We want to play our role, but really help facilitate in whatever way we can, kind of connecting relationships. And we also host this big event every year called Thrival Festival, which takes place in September. It's really going to start turning into more of a year-round event that encapsulates the different trajectories of innovation in the Pittsburgh region, series of innovation-focused programs that bring in national level and international level talent to share with our local talent as much as possible to help guide our thought process on what's driving Pittsburgh moving forward. That event is really a big sustaining driver for our organization, and I don't want to get into all of the different ways in which we as a nonprofit aim to sustain ourselves, but I can tell you that our goal is not to take investment in companies as our principal source of keeping the organization going. And what that does is it allows us to really say to an entrepreneur very bluntly, look, you don't need us. You need UPMC Enterprises, or you need Alpha Lab or Alpha Lab Gear. It's not, we don't have a self-interested reason to say, no, we want to be the ones who invest in you. And that allows us, I think, to really play well. We're currently located in East Liberty. We're going to continue to be located in East Liberty. And although there's nothing public about this yet, we are actually building a new office right now. And in that space, we're going to be adding different assets that will, we think, continue to better serve the early stage startup community and foster interaction between us and all the different kind of stakeholders, many of which are represented here. And if we try to represent all of those who are actually out there in the city with whom we should be interacting, we would be a much bigger room than this. For the sake of time, I know Larry and I were also going to field some questions and do a little panel section as well. And Larry probably has awesome slides, so you guys can stop looking at me. So thank you again for having me. I do have cards. I'll be sticking around after this segment. If anybody has any questions, always happy to field those. So thank you.
Part of why I'm here is that I've been here now for 8 years. And 8 years ago, this slide didn't exist. In fact, this slide didn't exist maybe 3 years ago.
All the purple stuff is new.
Right? So part of why I'm here is to catch up on the explosion of resources for people who want to get into innovation, for-profit and not-for-profit activities. How many people here have participated in a business case competition like Randall Big Idea or Pinch? How many people here have gotten government agency grants like R01s or SBIRs or SDTRs? That didn't happen when I started to give presentations a few years ago. People were not involved in this startup community. So I'm here because of the explosion of resources that are here at Pitt that I've seen, particularly in the last few years, that I hope that you folks will take advantage of. Okay, now how do I get to my set? Yeah, they're right at the top. So do I escape out?
Yeah.
There it is.
Okay, I'll even put you up like this. Ta-da.
So Innovation Works has also changed over the past 8 years. When I got here, we basically had the state of Pennsylvania that was funding us. Now we have 15 different sources of funds. When I got here, we had 1 accountant. Now we have 3. But our programs, Alpha Lab and Alpha Lab Gear, and now 3 Rivers Venture, have made Pittsburgh start to be a magnet for startups nationally. Now, IW is funded by the state of Pennsylvania. Our goal is to grow employment in the 9 southwest counties of Pennsylvania. That's how we're graded. But we, along with Bobby, along with Pitt, along with Rev Oakland, along with tens of incubators, accelerators, business case competitions in Pittsburgh, have started to put us on the map nationally. So this is not just a Pittsburgh resource anymore. We're getting recognition from around the country. Well, this is my busy slide. This is where you are in the university. We don't do R01 grants. We do have some university grants that I'll give you some data on a little bit later. But in terms of ideation, we have programs like Alpha Lab and Alpha Lab Gear, Energy Alliance. We have a program that over the last 2 years has invested about $350,000 in pre-company ideas that the tech transfer tees up to us. Seed stage where I sit, these are companies that are a little bit more polished. Typically, those companies have de-risked the supply chain or have had a proof of concept experiment where the likelihood of their success is a little bit less risky. God bless Bobby and Pinch and UPMC Enterprises, because they are really big risk takers. They really make big bets. We invest on average $5 million a year in between the pre-seed and seed stage companies. That's typically 50 companies. So you can see it's a lot of small bets. Historically, that's what IW was set up to do, to grow high-tech technology. We believe the way you do that is you try to invest in the fastest growing ideas that you can. That grows employment. In this stage, we typically said our companies are out of the nest. They don't need our help. Well, they really did, but we didn't have the money or the ability to continue to follow these companies. Until 2 years ago, we started an A-round, very small VC investment that if one of our companies goes and gets an investment from the outside, we will follow. So all those university programs that you saw are here. We have programs through this area, and then hopefully in the maturity stage, you get to see A rounds from local angel groups or early stage VCs. My point with this slide is that funding and support is a continuum. And what Bobby said was correct. There are many ways now in Pittsburgh to go through that funding and support continuum. If you're not finding, when I got here, my boss said, you got to see 90 people in 90 days or you don't know Pittsburgh. And I tell the entrepreneurs, if you can't find the people you want to meet in 90 days in Pittsburgh, you're not trying very hard. Okay. So IW has supported a lot of spin-outs. I'm very proud of these because a lot of them are life science spin-outs. In fact, there are companies on here that over the past year have raised $50 million. And there are current companies on here that are raising an additional $40 million. So there are money for good life science ideas coming out of Pittsburgh. I'm most impressed this year with Diamond Kinetics. They help hitters, baseball hitters, make their swings better, and they point to the fact that the Pirates are doing so well as proof that their technology works. I don't know about that. It sounds like an engineering claim, right? All right. So we work very closely with the Innovation Institute. By the way, when I first started, it wasn't the Innovation Institute. It was the Office of Technology Management and the Office of Entrepreneurial Development and the Institute of Executive Excellence or some such thing. Thank God they're all merged now and it's one. And all the programs are almost under that, except we have little nodes of other startup expertise that are cool. But over 25%, over 40% of the deals that we typically invest in come out of the universities in this area, over 40%. Okay, so we're not just set up for Allegheny County. We actually are responsible for the 9 southwest counties in Pennsylvania. That's the geographic territory that the state of Pennsylvania, through our parent in Harrisburg, charges us with helping. Our budget, although not entirely from the state now, the majority of the monies that we get to invest in companies comes from the state. So we have to follow their guidelines. And that is, you can't move out of the state for 5 years or we want our money back. But because we're also funded by the politicians across this whole area, anybody that knocks on our door gets a response. We offer business assistance, networking, et cetera. We only invest in about 10% of the companies that come to us, but the rest of the companies we have to support. Okay, so I mentioned that we get measured by the number of employees that our portfolio companies hire. We don't get measured by the amount of liquidity dollars they bring into the region. We do believe that the way that you get there is you try and get high growth companies. Now, at the latest Three Rivers Venture Fair conference, of course, when the VCs came in, we were showing them this slide, not necessarily the number of employees, right? $1.7 billion brought into the region from the outside. 23 companies in 2015 raised more than $1 million, and 70% of the companies that got this VC money came through IW. That is not good, because, as Bobby said, the region has more demand than supply. There is much more room for angels and VCs and accelerators and incubators and all this startup activity in the universities. We were just fortunate enough to be doing this since the late 80s and had a head start. But I suspect people are going to catch up to us. Another eye chart. This is large VCs that have invested in the region that made up the numbers that we showed you on the other side. So I'm sorry you can't read this, but basically what we show the VCs is your brothers are here, they're from all over the nation, and they like coming to Pittsburgh because of the quality of the opportunities that we have, and quite honestly, the fact that our opportunities are less expensive than these highly inflated East Coast and West Coast. They're not unicorns anymore. What do they call them when they crash and burn? I forget what the term is. I'll think of it. Okay, so we are proud of Alpha Lab and Alpha Lab Gear. Again, Alpha Lab started 5 or 6 years. Gear is only 2 years old. But we compete nationally with Y Combinators and these other startups that have a lot of press out on the East Coast, on the West Coast. We are nationally competitive. Now, I will tell you that 80% of the companies that Alpha Lab and Alpha Lab Gear accept are local companies. We're not set up to be, let's get everybody in from Boston and San Francisco. Our goal is to support the local companies. I will also tell you there are about 100 applications for our 2 Alpha Lab classes a year. That's 100 per class. And about 100 applications for our Alpha Lab Gear class, which is 1 class per year. That is spectacular in terms of the interest from the Pittsburgh region and the opportunities that are showing up. We're very, very pleased with that accelerator incubator program. I won't go back, but if you remember that continuum, all right, on this side of the continuum, outside the university, which starts at all the resources in the middle that support it, are the angels and the VCs. And we started what we call an A-round venture capital company about 2 years ago, raised $23 million. We intend to invest in 10 companies. They are not IW portfolio companies per se. They're the best companies in the region. The catch is the companies have to go outside and find an outside good VC investor that we know is a good VC and not just your grandmother who loves you and wants to give you $1 million, right? When that VC comes in, makes a legitimate offer, if we can follow on and syndicate with it, that's great. That allows us to grow in continuity with a VC investment in local companies. It's been very successful to date. We're very happy to have been able to start that additional resource for the region. Okay, this is not all of our staff. I am not happy to report that I am the oldest one of the people on this slide. Yes, I'm even older than Frank Demler. And I rub it in as frequently as I can. The idea behind this slide is that you have serial entrepreneurs, corporate executives, people who have been through a number of funding institutions from early stage to VCs. People have bought and sold industrial companies. There is a wealth of experience at IW, and I certainly have benefited from the team there. to help mentor, provide business advice, not only to our portfolio companies, but as I said, to all the other companies that come and knock on our door. Okay, I want to thank again the inaugural Integrative Conference on Technology, Social Media, and Behavioral Health for inviting me, and IW. And I can't emphasize enough, the infrastructure and the resources are there if you want to get into a startup business. We're waiting for you. Please give us a call.
We'd like to invite our panel back. If anyone has any questions. Karen, John, Rasood, Bobby, Larry? Yeah, please. I understand we don't have the right tables for the camera. Please.
All right, anybody? I got it first, so if anybody wants to ask me one.
I have a question. So,
Okay, Larry.
when did Thrill Mills start?
November 2012.
And how many companies or opportunities have you seen for the system?
So we have formally engaged with 46 companies. Our application cycles range between 120 and 175 applications. And I think that, I was thinking about that when Larry mentioned that the 300 total applicants that come through Alpha Lab and Alpha Lab here on an annual basis. That just goes to show you how much is out there. You've got to be selective when you're looking at which you're actually going to bring into the program. And that doesn't mean that the other ones aren't any good. It could just mean that the timing is wrong, the team isn't quite right in terms of composition, or that you just, maybe you feel like it's not the right fit for your organization in terms of the types of the team members you have and your ability to help them. So it's a big challenge, and it can be very frustrating because when you may go through that selection process that in all likelihood you're leaving like 4 or 5 or 6 out there that maybe you wish you had gone that direction instead. But you obviously can't go back in time, but what you try to do is be communicative with each other as organizations. So Jim Jen, who is the director of Alpha Lab, and Alana Diamond, who I believe is speaking this afternoon, is the director of Alpha Lab Gear. We communicate with each other about these things. They say, look, this one wasn't right for us. Maybe you guys should take a look at it. So it's just another example of resource sharing. So I think maybe the theme there is that if you have an idea or know someone who does, applying to one doesn't mean you can't or shouldn't apply to the others. You should be looking at all of these as opportunities. We don't consider the landscape competitive. We all exist because there are ideas out there, and if we don't foster those as best we can, we're all worthless anyway. Yes.
I have a question. So there's like a plethora of potential places to approach. Let's say if I were a faculty member at the University of Pittsburgh, where would I start? Would I start with John's programs, or go to RASU, or go outside to IW or Thrill Mill? How do I start?
If I was you, I'd start with us, because these guys were both judges on our last thing. We're all in this together. We're all of the same thing, but CTSI is going to be more familiar with you as a faculty member and your perspective and some of the constraints on what you do. But yeah, we're all in this together. We all want the same thing, and so if you approach any of us, you'll find all of us. I would say that.
I'll even stand over here now.
I'm going to invite Larry to be a judge at our next meeting.
If you're an employee of the university, you better disclose and go through all the conflict of interest procedures and get all the resources that are available to you.
That's something that's hard, I think, for some people to, at the university, when you're a faculty member here, there's a lot of resources that are there to help you. Like, if I didn't work here, if I just had my company or my own, my lawn servicing business, and I wanted to invent some new thing and I wanted to file a patent, I would have to come up with the $50,000 to file a patent, to say nothing of talking to lawyers. I mean, that was one part of it. But all of a sudden, it costs $100,000 to get out more. Now, as a faculty member here at Pitt, to start a patent, I go online and I click and I start typing, and they start taking care of it. They'll convene a committee of people. They'll say, look, John's a nice guy. This is an interesting idea, but we can't protect it, or we don't think there's a market, or we can protect this. We think there's a market. Let's do this. And so all that infrastructure is there to help me. And so I've worked in this small company for 10 years. I have 50 patents with them. I don't get anything. Here at Pitt, if they file a patent and, between Larry and Bobby and Rasul, it turns into something, I get 30%. I get actual money. And that's what Mark said earlier. He said, look, we're not here to make money. Our job is to give it back. And so if you're here, there's a lot of resources that are here to make it work. And I would also say, if you try to go and circumvent that and go to Larry, he's going to say, this is all screwed up. This is really hard. This is really hard to fix now. So
just to add on to that, I do think that early stage ideas, etc. John and his team do a great job in nurturing them and really pushing them along. I think any one of us, if you come to any one of us, we'll point you in the right direction. Right? There are specific things that we focus in on here at UPMC Enterprises, but we don't do this on our own. It's not just us on the second floor of Bakery Square. We do this as a cohesive group of individuals and organizations across Pittsburgh. It's those bridges that I talked about earlier. So really, regardless of who you approach, I think very quickly our goal is to try to nurture the ideas, nurture those opportunities, and point them in the right direction, and make sure that we're able to contribute positively to those ideas.
So this is for John and Russ. You guys are free. I'm not going to want to answer this one. So we work with a number of hospitals and primary care practices where we try to implant a lean quality improvement culture and lean quality improvement techniques. And it is like planting a turnip in cement. If you don't have the right culture, you can bring techniques and ideas and ambitions. So are we doing a lot here at the university to develop a culture of entrepreneurship and innovation and kind of mirror that new world of invention that you feel in certain places and you may not feel in others?
Great question. John, do you want to take it?
I think we're trying, and I'm going to cite as evidence that we didn't plan this, that Larry's just saying, put that slide back up. None of this stuff was here when I started. And I think that that's evidence that we're making progress. Now, working on trying to do that at the University of Pittsburgh, so I have a focus that's kind of clinical and health related. The university has a lot of other things they're doing, and so that culture we're trying to grow as well. The clinical operation is a whole other business, right? It's a whole other thing with a bunch of different, very different kind of constraints and pressures, and that's something that I don't sit in that world. We try to fix things there, but it's different. And so I'd say as a university, we're trying to do that. We're getting good feedback that we're doing some things right. We've got, I'll be around for
You
that.
guys are also incorporating the UPMC health plan in your decisions. The economics side of the provider payor integration now we see is becoming closer to closer. I will tell you my rule of thumb, which I've been criticized for as being far too easy, is if you're not twice as good clinically and half as cheap, forget it. The switching costs are too high. And somebody came to me and said, it's got to be 10 times better and 10 times cheaper. The switching costs are too high in the system. Switching costs are very high because of FDA requirements, large system requirements, training requirements, etc. So when we see a new idea, if you say, oh, this is just as good as what's out there, I don't know how you're going to break into the system.
Great point, Larry. Just a point about culture. I'm a big culture fanatic, right? It's really important to nail culture and forget about strategy. Culture needs strategy for lunch, breakfast, and dinner, I think. Right? So, in healthcare, as a clinician, I can tell you we have a culture of going with the tried and tested. That's how I was taught. That's how we continue to teach our medical students, our residents, our fellows, and attendings. Look, if it didn't kill someone, if it worked better, peer review, all of the things that we do in healthcare today is going with the tried and tested. And then we come along, right? We say, hey, trust us innovators. This is brand new, but trust us, this will work better. It's really important to acknowledge the fact that there's this culture of going with the tried and tested in healthcare, and that at the same time there's this culture that we're trying to build at UPMC through UPMC Enterprises and across the organization. Part of what we're doing at UPMC Enterprises is to make sure that we're not just doing this in isolation, right? So we're doing this on behalf of the community. We're doing this with everyone else at UPMC. So we work with Tammy Munier, the Chief Quality Officer at UPMC. We work with the health plan. We work with our clinicians, our researchers, our head faculty, and our colleagues across the street at CMU. And we try to make sure that we have this culture of fail fast. We embrace the methodologies of design thinking and ensure that we have the right set of capabilities to support them so that they can take from an idea to a venture that's actually commercial.
I'll add just on the note of the university as a whole and entrepreneurial culture, just a point of criticism maybe. It's a really hard thing starting a business. It's really hard to make money starting your own company. I think that all of the activity is fantastic, and I've been involved in judging different things from the big idea competition to helping with the blast furnace, which is an underground kind of internal incubator program for students. But you can't, it can't all be cheerleading because it's really hard. There needs to be hard criticism delivered to those who think they want to pursue entrepreneurship. When they come with the idea, it's got to be a great idea, not really actually. It's great that you have an idea, it's not really that good. And here's what's going to take to really get it to a place where it could be any good. So it's a challenge that we face even working with entrepreneurs in accelerator programs is there's this sense that, oh, I made it, look at me, I got into Alpha gear, I got some money, and I got a cool office with a garage door lift for crying out loud. Like, there's a ping pong table here, what else do I need? They watch Silicon Valley, the TV show, they think they're in there. So, but you have to beat down that feeling very quickly and say, okay, you're at the beginning of the process now. Now it gets really hard and you're gonna really have to grind in order to make it. So it's all those behind closed doors things that need to happen to make any business successful. So from a cultural perspective, I think celebrating the idea of engaging in entrepreneurship is great, but then you have to quickly turn it into celebrating how challenging it really is, and being honest about the fact that you've got to adapt quickly, handle criticism, and be able to overcome daily challenges to really get it work.
We see is because of this relationship with UPMC and UPMC Enterprises, now putting together the team that can evaluate vendors so many times better clinically and so cost effective. They also have the opportunity to do the proof of concept trials, and the preclinical trials, and the clinical trials in that entity. Without that, we can't get it. So we think that they're putting all the pieces together, like a clinical research organization, support structure to get things through their process. Completely. If Pitt and UPMC Enterprises said, we picked it, we trialed it, we did preclinical, we did our phase 1 and phase 2 trials, you would have people all over you trying to invest in that company. The quality that's there is great. You got to get the process streamlined too.
Yeah, John, but extend your model just a little bit. The model works well for people who are within the UPMC system. Somebody from the community who comes in and says, I've got a great idea, but I need the expertise or the laboratory or the equipment available at the university. How do you incorporate or facilitate such an entrepreneur to collaborate or make use of what you have, even though the idea doesn't originate within the university?
Oh, the idea doesn't have to originate within the university system. I'm glad that you asked this question. We talk to those sorts of individuals day in, day out, all the time. Not necessarily even from the region here, right? They could be from Israel, they could be from the other coast, right? So what we do is we work hand in hand with the individuals in what they have, evaluate them. We have a fairly rigorous vetting process where we pull in the subject matter experts from the region here, primarily from UPMC and from Pitt, and really vet the idea of, right, is it a specific thing that falls into one of our domains that I described earlier? right? We have access to lots of data and hence insights across the payer-provider realm that is UPMC, which really is a model that I think healthcare is moving towards. So we're able to compare a specific idea or a solution with the reality of what exists today at UPMC, and really try to figure out what stage of the idea is it at right now? What's required to take it from where it is to where perhaps it needs to be before we're able to then have make it even bigger and make it into a true commercial success. And then at that point, we're able to pull in the right collaborators across the board. And there are multiple different vehicles that are, I think, available. The Pittsburgh Health Data Alliance is one such vehicle. The Pinch process is another such vehicle. So it really depends. But we talk to these individuals and entrepreneurs day in, day out. They're not just from university.
Yeah, and so we, with Pinch, we have a constraint that we can only write a check to a faculty member, but that faculty member can have partners and collaborators that consume most of the money we give to them. And we've got examples of that where one of the recent Pinch winners, the guy in his garage, has invented this thing. He owns all the IP, and it's going to, they want to try it out. Our PIP faculty members says, look, this is a great thing. I want to start trying it out in the clinic. And so, Mark and I, and we all sat down and said, look, the IP is all out there. Can this person continue in our competition? Yes, they can. They ended up winning. And so that's an example of, outside technology that we're giving the PIT investigator the chance to research it in his setting. But the bulk of the money is being spent on buying the things from the outside person. And so we do that because we want to facilitate those types of things. So what I would say to you is, do the next Pinch. Call me, call somebody, get a faculty member on your team, and sign up.
We have time for one more question.
I was intrigued with the innovation of the disciplines as an area of curriculum development that you're focused on. And when we have courses where we collaborate with the law school and with the bioengineering school, and the just explosion of commercialization of projects around the university, I think has really enriched our ability to teach students how to do parts of the innovation process. So I'm really intrigued with how, will it focus on innovation ecosystems, the commercialization process solely? Will it be like the GEAR program? Is this university-wide potentially?
Yeah, a lot of it is focused on providing faculty education. And one of the first things in my list there is to meet with, set a monthly meeting with someone from Wishwa's team. I saw him here. We're going to be setting up coursework, formal coursework in the Institute for Clinical Research Education about innovation. We're going to have externship programs where people here at the university, a faculty member, a fellow, can go down to enterprise and work for several months as part of a project team, which is it's a very different environment when they're developing products than when you're trying to run your lab or run your clinic. And so we want to provide both coursework kind of things and experiential learning, and then also mentorship. But with the idea that one of the things that when we made it up, right, innovation is a discipline, we're trying to think what differentiates that from what a normal faculty member does. And one of the things that we really find is important is the ability to, you can use design thinking or whatever it is that involves going out and discovering the customer and listening and then pivoting your work. It's hard for an investigator to say, look, I've got 15 years into this lab, I've got 8 NIH grants, I've got all this going, this is the direction I'm going. And when you tell them, look, why don't you listen to these people? There's something you could do. That's not easy. But if they can do that, that's kind of an innovation behavior because it's adapting what they're doing to a problem in a market. And then all of a sudden, there's this pull for success. So we're inventing innovation as a discipline, but we should talk. Yeah, I'd love to work together. There's going to be formal coursework and externships and things like that.
Ken, thank you very much.
I was hoping I got some tips.